Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us once again for our weekly press conference on Delaware's response to COVID-19, our update that we try to give you each week, particularly over the last couple months with the surge that we've seen after the Christmas, December holidays and the New Year celebration. People ask me all the time, how are things going? And my response is always dependent on how many positive cases we have on a 70-day moving average, how many people are in our hospitals with COVID-19 and in the hospitals, frankly, for other reasons, what our percent positives are. And we'll go to that in a minute. First, I want to thank Dr. Carol Rattay, who's joined us once again, and her team at Public Health for their continued vigilance in this as we move from one phase to the next, and every phase is a little bit different and has a little bit different focus and concentration, and we'll talk a little bit about that today as we kind of move, I think, into a new phase. We'll talk about that driven by the data. We've got AJ Shaw, who's our director of the Delaware Emergency Management Agency, and AJ and his team of emergency responders across our state have really been challenged of late. Pam, who's our sign language expert for the deaf and hard of hearing. It's great to have her as well. AJ, I know firefighters across our state have been fighting some really terrible events of late, and I want to first start with a thank you to those fire departments and to Laurel Fire Department, in particular with the big blaze that they had, the Rigby apartment fire. Lots of folks really came to the support of those families in the town. La Esperanza and the Red Cross were instrumental, and really a special shout out to the Good Old Boy Foundation, really coming forward to show their community spirit to help these families that were displaced, multiple families displaced in that fire. And really just goes to show you the really community support and public service attitude that we have across our great state. First in the first responders that responded to that fire, then the Little Creek fire that more recently with 2 fatalities. Just sadly to lose lives like that is really just pulls on your heartstrings. And of course, our thanks go out to all those responders. I know it takes its toll on the responders themselves as they see their efforts in the case not enough to save those lives. So to the Laurel Fire Department, to the Good Old Boys, Red Cross, La Esperanza, Little Creek Fire Department, and other departments that responded to those blazes, thank you for your support. I mentioned that I watch the data every day, and we're going to give you the update here. All of these data are getting better, pretty dramatically so, and which is really indicated that we're moving into a different phase now, not dissimilar to what we experienced last year. Frankly, the peak of last year was on the same day, January 12th, as it was this year for hospitalizations. But here, first, the new cases on a 7-day moving average down to 450, still a high number in the context of things, but way different, 90% down from over 3,000 just a couple weeks ago. Percent positives, importantly, are moving down as well, down 60%. 1 in 3 of the tests, and testing at a very high rate, 60,000+ a week. 1 in 3 were positive, and of course that's down to 12% again on a 7-day moving average. And the number that we pay special attention to, particularly in this latest surge, is the hospitalization number down to 237. Well, that's a very discrete number. The hospitals count those folks every day. We've talked about the difference being hospitalized for COVID, to be treated for COVID, serious disease as a result of the COVID virus, or with COVID, admitted to the hospital for a heart problem or something else, and then testing positive for COVID. I've heard from governors in other states that they have experienced the same thing. It has driven hospital numbers up, but the primary reason isn't so much COVID-19 as it is a series of other reasons. That doesn't change our response. to help the hospitals, and we've deployed National Guards men and women both to do non-clinical responsibilities in the hospitals, as well as training them up to be CNAs to work in our long-term facilities so that the hospitals can discharge patients who don't need hospital care but can be served in our long-term care facilities. I've heard from both the hospitals and the long-term care facilities that have been a tremendous help in both venues and really helped decompress the challenges in the hospital. So our hospitalization rate is down from 759 on January 12th that to 237. Last year on the same date, we'll see there you see the roller coaster ride. The same date last year was 254 on February the 8th. This year 237. And so even though we had a steeper increase up to 759, only 474 last year, we're at a lower stage in hospitalizations. I think part of that is the help that we've provided on the long-term care facility side of it, so the hospitals could discharge patients into those additional facilities. Now, notwithstanding the fact that all the things that we've done to help the hospitals decompress, driving the hospitalization numbers down for COVID, they still have a very high census. You can see that in our next graph. We show this to you every week, and you can see they're up there at a very high level, several hundred higher than where they were at the same time last year. but most of that is not driven by COVID hospitalizations. As you can see, our number today is lower than it was on the same day last year. So the long and short of it is, all the data indicators are improving. We're not out of the woods yet. We still have higher levels of COVID positives that we'd like to see. We'd like to see the percent positives below 5%, but we've made tremendous progress on the peak of January the 12th. We've made tremendous progress with our partners in the hospitals, driving, decompressing their facilities and helping them and the morale of the people that are working there. On the vaccination side, things haven't changed a whole lot. Our numbers are still pretty high and pretty good, almost 1.7 million total vaccines administered, 67% of the total population. That includes the very little ones who are not eligible. And then you can see the numbers down below in age groups, age 5 and over, 70% fully vaccinated, 65 and older, 94% fully vaccinated, and then the other numbers in between in the 70s. We still have more work to do, and that'll be our focus as we transition into this new phase, really encouraging people to get their shots, be fully vaccinated, get your booster shot, get the younger children vaccinated as we move into a period where it's going to be more important that they are vaccinated. They've now become eligible. We look over on the booster update. You can see we still need to do a lot of work there. Dr. Rattay talked a lot about the boosters in our last press conference last week. We really need to lean into this, and we'll have an opportunity to do that. We shouldn't just say, okay, things are getting better. Positive cases are down, percent positive are down, number of people in the hospitals are down, but we still need to lead into getting people fully vaccinated. Some places, geographic areas in our state, not as highly vaccinated as others. Some schools, much more highly vaccinated than others, and so the conditions are dependent in some part on what part of the state you're in. So here are the numbers with respect to the booster update. We just need to do better than 42% of the total population. We know on the other side, we're into the 70% range, 67% on the total population for being fully vaccinated. So we need to get that difference, those folks boosted, because it's going to give you so much additional protection that's necessary. So what does all this data mean? It means that we're moving into a new phase. and that we've made a decision that the mask mandate that we put in place after the initial January surge to really try to help in flattening that curve and helping pushing that down, protecting every Delawarean, is not necessary going forward. And so as of February 11th, we will be lifting the universal indoor mask mandate. That doesn't mean if you want to feel completely comfortable, you put on your mask yourselves when you go into closely populated indoor environments. I think about that all in the context of my visitations to my 90, this month she'll be 91 years old, my 91-year-old mother, and how much exposure I've had out in the public. What is the risk that I might be exposed to COVID, and the risk of taking that in to my 91-year-old mother, who, by the way, is very healthy. She struggles to get around a little bit, but she's very healthy. I wish her mask wearing compliance was better, but it is what it is. So effective Friday, February 11th at 8 a.m., mask will not be required by the state in these indoor places, convenience stores, grocery stores, gyms, restaurants. You'll remember, just think back a month or so ago, we didn't have the indoor mask mandate. The cases got so out of control in early January. I, as governor, decided we needed to do something. And the one something that I thought we could do to take that extra effort and to feel like we've done everything to protect our hospitals in particular and the hospital capacity was to impose a mandatory mask mandate for indoors. Whether it made a difference or not, I think it made some difference. I like to believe that any little bit helps. That was our reasoning going forward. You'll also remember when asked the question, how long are you going to have the indoor mask mandate? I said, not one day too long. Well, figuring out when that one day is not as easy as it might seem. We follow the data. We consider the spread of the virus in states around us. We look at the actions of those states. We look at compliance in our state, and then we make a decision in terms of what's the big thing. So we're moving into a kind of a more of an emergency environment where the government has a mandate for that kind of a compliance to your own personal responsibility based on the venue you're in, your health and wellness status, your pre-existing conditions or not, how prevalent COVID is in your particular area. And we expect folks to take that responsibility. We'll monitor these numbers on a daily and weekly basis to make decisions in the future, but starting on February the 12th or February the 11th, with respect to masks that will not be required indoors. I will continue to be careful around my mother and in respect to some of the employees who work in the various convenience stores that I frequent, and I would expect that others will do the same. And additionally, we've decided that as of March 31st, we will remove the requirement in schools, the emergency requirement at the state level in schools and child care facilities for those children to wear masks. The reason that we've moved that to the end of the month is to give school districts time to make decisions within their own schools and in their districts, to give parents the opportunity to get their children vaccinated, giving them that extra protection, the opportunity to consider local mask requirements in those districts, and the opportunity. We've had some changes and updating of the quarantine and contact tracing requirements for everybody to understand what they are and to implement those in the schools. I think it's really important to point out that our highest priority has always been to get children back in school for in-person learning, and that masking has been an important part of that. We also know that wearing masks creates issues among children in the learning process. And so there's a balance that needs to be struck there. And we've tried to strike that balance. So far, since this information has been known more publicly, I've had as many people that have said it's not soon enough, as have said it's too soon. Maybe since half have said it's too much, it's not too soon, not too soon. Maybe we have it right on the nose. We'll see, and we'll monitor that as we go on, and we'll help our schools and school districts administrators make those decisions. We still have public health employees who have been assigned to each of the districts and are there to consult with the decision makers about what to be done there. Lastly, and before I turn it over to Dr. Rattay, just here a commercial to remind you how much more effective the vaccines are when you have your booster. The vaccine effectiveness does decrease over some period of time. And so you need to get the booster. You're really much better off, much higher percentage of avoiding hospitalization if you have the booster shot. It can really help in a big way. And so before I turn it over to Dr. Rattay, I do want to once again thank our first responders, the Good Old Boys Foundation, and Laura for reaching out for your public spirit, and you're helping those that displaced in that fire down there. And for those that responded to the fire in Little Creek, thank you for your great service. Dr. Rattay.
Thank you, Governor. So today I want to start with a brief update on pediatric vaccination rates in Delaware. And I also want to talk about something that's been going on throughout the pandemic, but which feels like it's growing and is really giving us significant concerns. And that's the topic of misinformation. So first, as we look toward the future, it's important. We know that the most important way to protect ourselves and our kids is vaccination. And so while we are making some progress, we are not where we need to be yet with pediatric vaccinations. So for the 5 to 11 population, which has now had access to vaccine since November, we have 30% have received one dose, but only 22%, 22.7% of that school age population is fully vaccinated or up to date with their vaccine. In the adolescent population, which has all had access to the vaccine since May, we do have 64% of that population who has received one dose. But now that that's a population that can receive boosters, we only have actually 11% of that population that's considered up to date with their vaccines. And so this is an area that's important to us in public health and with the Department of Education to continue to work with community, with pediatricians, but also with schools to do all we can to increase these vaccinations. But I will say as a pediatrician, I just cannot emphasize enough the importance of getting our kids up to date with their vaccines. So, if you have questions or concerns, please talk to your pediatrician. And the next few slides will highlight why it's important to question information you have been seeing or that you may see on the internet or from others who are not experts in public health or medicine. So misinformation and disinformation campaigns continue to cause confusion that DPH and other states are forced to clarify. It takes away valuable focus and particularly has a negative impact on those who can be swayed easily. Vaccine information leading to vaccination avoidance can contribute to hospitalizations and deaths caused by the virus and is considered a significant public health threat. It's so concerning that the U.S. Surgeon General, Dr. Vivek Murthy, issued an advisory last summer warning the American public of the threat. He said, health misinformation including disinformation, has threatened the U.S. response to COVID-19 and continues to prevent Americans from getting vaccinated, prolonging the pandemic and putting lives at risk. As of late May, 67% of unvaccinated adults had heard at least one COVID-19 vaccine myth and either believed it to be true or were not sure of its veracity, according to a survey analysis and research that was conducted by the Kaiser Family Foundation. So what is misinformation? It is information that's false, inaccurate, or misleading according to the best available evidence at the time. Disinformation is actually more sinister, and it is spread intentionally to serve a malicious purpose, such as to trick people into believing something for financial gain or political advantage. Now, most people don't fall under the category of spreading disinformation, but they may spread misinformation because they don't know that the information is false. They haven't checked it through credible sources such as CDC, the National Institutes of Health, the Journal of the American Medical Association, the American Academy of Pediatrics, or other credible medical, public health, or governmental resources. So there's different types of misinformation, and it usually falls in one or more of 7 categories. Memes are in general fun, colorful images or graphics that were usually created as a joke, but then people reshare thinking that they are true. And an example that happens to be popular right now is one with a bird claiming that birds are actually drones and not real. Websites that often look professional, designed to look like news sites, but have stories that are false or misleading is not uncommon, unfortunately, and they usually have sensational headlines designed to make us click on them. Another area of misinformation is quotations, where the beginning or end or part of the quotation may have been deleted or changed, which also changes the meaning. So maybe the person did say what was quoted, but without the full context, it's not a fair representation of what they said. Old images that are recirculated as if they're actually very recent is something that we have seen during this pandemic. Also, misleading graphs or diagrams that look official but don't tell the whole story is something we see. Similarly, adding an official looking logo like the CDC's to the claim is seen. Cherry-picked statistics, and as an epidemiologist, this one drives me nuts. Too often we see people choosing the number that supports what they want to argue, but without all the data, they haven't provided all the context. There's a recent paper that just went viral last week that meets a lot of these points. The paper suggested that lockdowns didn't work, but the authors, who are not credible scientists, they cherry-picked the studies that they used. It was not peer-reviewed by scientists. And then they added a logo from Johns Hopkins University on the paper, which really led to it being shared by multiple media venues. So these are the types of things that we need to keep our eyes open for, including videos that have been edited to change the original meaning. So the Surgeon General's office has created a misinformation checklist. This is what you can do when you see information to help you assess whether or not it's credible. First of all, did you check with CDC sources or the health department, us or other health departments, to see if there's any information on the claims? A couple really good sources, FEMA, as well as an entity called Public Health Communications Collaborative. Both have misinformation alert pages where you can often find out more information about these circulating claims. You can ask a trusted healthcare professional like a doctor or a nurse. Also, did you check online to see if it has been verified by a trusted source? Again, you're looking for trusted and known government sites or professional medical associations. Did you review the About Us page on the website to see if you can trust the sources? And lastly, very important, if you are not sure, don't share and contribute to the spread of misinformation. So I want to take a deeper dive into some more recent examples of misinformation. One is the type of face mask that one should wear, which has received a lot of attention and has become very controversial lately, really creating some confusion and we've seen a bit of misinformation. I've seen from multiple people that they say the CDC says that cloth masks are useless. But the evidence from numerous peer-reviewed studies show that cloth masks can certainly help to prevent the spread of COVID. So again, the myth is the fact that CDC has said cloth masks are no good anymore, which is not what they've said. People have gone too far in interpreting CDC's guidance on face masks. They did not say that you shouldn't wear cloth face masks. However, they did say that respirators and KN95s, especially those which provide a better seal around the mouth and nose, may be better. But the bottom line is that any mask is better than no mask at all. And the most important thing, again, is that your mask, whatever it is made of, is multi-layered and fits well around the mouth and the nose. Now, we've added several sources to the bottom of this slide, including one from the CDC, which really does a nice job summarizing the trials that support the effectiveness of mask use. On that page, it says multi-layer cloth masks can block 50 to 70% of fine droplets and particles. Let's turn to another area where we've seen a lot of misinformation. And this is the debate on whether infection-acquired immunities, what some people call natural immunity, is better than vaccine-acquired immunity. The fact is, vaccine immunity provides more reliable and stable immunity than infection-acquired immunity. And additionally, emerging evidence shows that getting a COVID-19 vaccine after you recover from COVID-19 infection provides added protection. But the myth or the misinformation that's been promoted is that the CDC admitted that a recent study shows that immunity from COVID-19 infection is better than immunity from vaccination. And the fallacy is that they've misinterpreted or taken a piece of data to promote their point of view. What the study indicated during the Delta variant period was that while natural immunity offered good protection, the best protection was found among people who were vaccinated after a previous infection. Now, this study was conducted during the Delta wave, and while the Delta wave is still present, or Delta, I should say, is still present in the US and around the world, the Omicron variant is now dominant. And last week, we discussed a number of studies that look at the efficacy of vaccines and especially boosters in preventing infection, hospitalizations, and deaths while Omicron is more prevalent. So I really want to emphasize that there's no safe way to acquire natural immunity. And while a COVID-19 infection can provide some protection, vaccine-acquired immunity is just much more reliable and a lot less risky. And this has become because the protection someone gains from having an infection, it varies depending on the disease, from person to person. We don't know how long natural immunity might last. And the level of protection people get from getting COVID-19 also may vary depending on how mild or severe their illness was, the time since their infection, and any underlying health conditions and their age. The COVID-19 vaccine helps protect you by creating an antibody response without you having to experience sickness. Getting sick with COVID-19, as we have seen, can cause severe illness or death, and we can't reliably predict who will have mild or severe illness. And you can continue to have long-term health issues after COVID-19 infection. So lastly, one study that I want to point out showed that for people who already had COVID-19, those who did not get vaccinated after their recovery are more than 2 times as likely to get COVID-19 again than those who got fully vaccinated after their recovery. So I really want to encourage you to check your sources And make sure that any studies that you're sharing or citing to others are peer-reviewed studies, which you can identify in the study citations. And while we work at DPH every day to combat misinformation, we are working to roll out a webpage that highlights common misinformation alerts and provides the facts for the situation. We hope this page will be live within the next few weeks on de.gov/coronavirus. And with that, I'll turn it back to you, Governor.
Thank you very much, Dr. Rattay. Lots of misinformation out there, even the good information that is there, sometimes hard to find and hard to get to. And public health's really doing a good job making sure that folks are able to get good information from the website and get directed to places to get tested, to get vaccinated, and have information that folks need to protect their children and their families, keep kids in school, make sure they protect our elderly senior citizens. So thanks for the help of your team. AJ, give us an update on testing, some things, other things on the emergency management side.
No, thank you, Governor, and good afternoon, everybody. I'll start with the kind of the rearview mirror look at testing. If you remember, post-holidays, we were just around 60,000 tests a week. We have now seen 4 consecutive weeks in a row where we've declined. We're almost half of where we were during our high watermark of testing in early January. We did 32,000 tests, almost 33,000 last week. So the capacity is there, the availability is there throughout the community sites. On top of that, we know that the pendulum has swung, and we talked about this late last year. There's such a high need for testing. The rapid tests that you could find in the Walgreens, CVS, Walmarts, etc. Now they even sell them at Wawa's. They were off the shelves around the holidays, and you couldn't find them. Probably between Thanksgiving and Halloween, you could walk in any store and pick up a box or two. Now they're back in stock, right? So we have they're commercially available at retail establishments. The federal government has their option to order them to get shipped directly to your house online. And then Dr. Rattay's team has been working with trusted community partners and has also distributed about 50,000 over-the-counter test kits over the last month to make sure we get to communities that need the test the most, and there might be a gap in. In addition to that, we know the county executive in Newcastle County has also done some force multiplication of our efforts and helped out as well with distribution to some vulnerable groups, as well as put them in the libraries and help out with the responders. So the 30,000 number last week is the PCRs. They're the tests that we're getting confirmation back on through Dr. Rattay's team. We know that number is a lot higher, but what the governor went through as he opened up is we've seen the present positive continue to decrease and hospitalizations decrease. So much different position than we were this time last month, much better. However, the testing numbers, we have to look at the whole picture, knowing that there's more than just the PCRs or those that are done through a system where public health gets the results of them, and they're all important. They're all helping ensure people know their status as early as possible to make sure they make smart decisions. So again, if I've mentioned a few options, we also have the de.gov/get tested, which shows not just only state-sponsored sites, but other partners that are offering testing. So then I'll kind of go for the testing over to what the governor also opened up with, and that was the hospitals. Again, much better this week than just 2 weeks ago from where the hospitals were at what we would say a COVID record for capacity, 700 plus COVID admissions, several thousand people in the hospital, some where they weren't able to get beds for, some they weren't able to get discharges. A lot of a good looking slide here, we'll put it this way. The COVID rates are going down, which means hospitalizations go down. Usually it takes a little bit longer for that number to follow suit, but we're in the 200s now. So, a third of where we were a month ago. The hospitals are still at a point where I know they're trying to catch up. They are still holding off on some procedures. Some they will do if it doesn't require an overnight stay. It depends. It's not one answer fits everything. But we did support the hospitals about 6 weeks ago, or about 5 weeks ago, is when they got deployed with National Guard service members to help in non-clinical roles. We have just about 200 that are out there supporting, from Nemours down to Tidal, to some capacity whether it's delivering meals, moving patients around, helping with screening. They're there to help the hospitals however they could. We're going to start demobilizing that in the next week. We're going to do a very strategic approach to this so we don't impact the operation of the hospitals, cutting back, a certain percentage each week till middle of March. And they have been very receptive, great feedback on the Guard. And it's one of those missions that I think will chalk up to being a great success as we go forward. The other mission that the Guard is on is the CNAs, which are being used in nursing homes and long-term care facilities. We're going to look at that mission with a little bit more of a fine-tooth comb. All in all, we have over 400 Guard members on orders right now: testing, vaccination, supply distribution, the hospitals, CNAs, call centers. So they have been a pool of enthusiasm and talent that we tapped into here, and can't thank General Barry and his team as much as I can. So with that, I'll close it out today. Just a few things to go over, and I'll turn it back over to the Governor.
Yeah, AJ, thanks a lot for that report. Just a couple things there. We mentioned the fact that on this same day last year, the hospitalization number was a little bit higher, so we're lower than that. It was a very steep increase up to the peak of 759. We had other factors there, as we've talked about, people being in the hospital with COVID and not so much for COVID. Just a little bit more context with respect to the two missions there. So the non-clinical activities, great feedback from the hospitals. And frankly, an idea that in part came from Dr. Tam down at BB. Each of the hospitals responded very positively. Understand that they've reached out for other assistance with their staffing concerns. So in addition to the surge in patients, they also had personnel, had employees that were out because they tested positive. A little bit more context there. And then, of course, the really smart thing that you and your team did was join up with the opportunity to get the Guardsmen and women trained up as CNAs to decompress. I've gotten really good feedback from that, AJ.
No, so I'll start with that one first. And that was, something that Hospital Association kind of came to us with back in, I would say, late November, early December, saying, hey, we see this getting worse before it gets better. We have to look for a way to help decompress the hospitals. We knew the nursing homes were having staffing challenges that the rest of society is having right now. So we identified, over 100 Guard members that could do an accelerated program. I had great cooperation from Adel Tech. Those individuals started right after the holiday. We had to get them their backgrounds, their drug tests, their immunizations. They went through the classes. They went through the practical sessions with other facilities, and then they got put in homes, middle to late January. And we're also assuming some of those Guard members will, stay in those fields as they come out of this mission in March or early April. We were just talking this morning about doing some type of mini career fair to help some of those facilities out. So that was definitely, a very, we say everything where, imaginations are failure, or failure of our imagination will be sometimes. And that was one of those things where we took the ball and we ran with it, and thanks to some great partners, had some success there. The hospital mission, you're right. Dr. Tam kind of teed that up for us and made us scratch our head saying, hey, we can't find nurses. We can't find you doctors. They're a hot commodity. There's, the federal resources that were identified to go to different states and municipalities were put to those with the most dire situations. Good news is Delaware didn't have to make that argument. Bad news is Delaware didn't get some of those other federal resources. But what we got them was some breathing room, and I think it was another good example of being flexible. What can you do, right? So anybody could pick up a tray and deliver it to somebody. Anybody could sit with a patient that may need somebody because they have dementia or something like that, where just for their own safety. So some great stories we've heard from our Guard members. I think it'll be definitely something that they enjoyed. And like I said, I think a few weeks ago when we announced this, it's nothing that they probably thought they would be doing when they joined the National Guard, but they definitely serve their community in probably one of the most trying times we've had here in Delaware. So definitely exciting, and better now that we have better data to show than just 3 or 4 weeks ago.
So huge kudos. Thank you, AJ. Huge kudos to the men and women of the Delaware Army and Air National Guard coming up big once again, General Berry and his team, the way that they were welcomed and embraced by the hospitals was extraordinary. It was as much a morale boost as anything else. And the photos that we saw, they came in with their uniforms and they were ready to go. They were National Guard ready. They were Delaware 1st Regiment ready. And we thank each of them for that. You mentioned the testing numbers being down. And so we're moving into a new phase where folks need to think about testing as a way to monitor the spread, the existence of the virus in our communities. A lot of rapid tests that are available, as AJ pointed out. Many opportunities to get a PCR test if necessary. If you have those flu-like symptoms, stay home, don't take any chances, get tested. That's the way we're going to control things moving forward. We rely on so many individuals to do that. Our numbers are getting better every day. We've got a highly vaccinated population here in our state, still have some work to do there and getting people boosted. We're at a much better place than we've been over the last couple months. We've peaked again on January 12th, same as last year. We're at a lower level in terms of the number of hospitalizations than we were on this date last year. And as I like to think, better days are ahead. Thanks to all our team. We still got a lot of work to do. We got a lot of work during this month of March to be prepared to go maskless in our schools or to continue that requirement depending on the district. We look forward to the challenges of the next phase. So thank you to our partners across state government. Thank you to our hospitals, our first responders, our EMTs, our National Guards, men and women. I know we have a number of media who've joined us today, and we look forward to any questions that they have.
All right, thank you, Governor. The first question is going to come from Meredith Newman of the News Journal.
Hi there. I have a couple questions. Just to start off, Governor, can you explain why the state is diverging from CDC and White House recommendations regarding masks in schools?
Yeah, so I wouldn't say we're diverging, just like to take a step back. We're looking at the whole picture and the trajectory of this and where we are. We've got the tools, we believe, to control. We're in less of an emergency situation than we've been, where the state determines what happens in each individual school district and schools. That doesn't mean that those districts can't, and they should, make decisions on their own based on what they see in their local area, what they see in their schools, the advice they get from our team that's in the field with all of them. We follow the guidance we get from CDC. We're on the White House call on a weekly basis, and they provide support in many ways and guidance, but the decisions really have to be made here on the local level. I look to my fellow governors in our region. We just had our National Governors Association meeting in Washington, D.C. We're with President Biden and his team and Jeff Zients, and we were all looking forward, looking to how do we adapt to changing conditions. The whole idea of people in hospitals for or with COVID was a big issue in each of our states, and therefore looking for some indicator of the severity of the disease. How do we move to the next step where we're doing a better job balancing the mental health of our students and population with our physical health? And that's how we arrived at the decision that we've made, looking forward to the month of March to evaluate all those circumstances, get more children vaccinated to be prepared for the next phase.
And heading into the school year, there was a number of school districts that had, rowdy, to say the least, meetings regarding the mask mandate that wasn't up to them at that point. Is there a concern with it being more in their hands if they wanted to continue a mask mandate for the rest of the year, that the decision might be more political than based on science, just knowing how passionate, again, to say the least, parents can on either side can get?
Yeah, I don't consider it a political decision or pressure per se. You've heard me say time and again that a leader without followers is, not very effective leadership. And so somehow you have to strike the balance there to keep people following you. And that's kind of what we've tried to do here, is strike that balance. As I said earlier, I've heard, half the people have talked to me said you're doing it too soon. Other half, you're not doing it soon enough. We know that there are competing interests to be balanced, not political interests, but interests with respect to the best learning environments and the safest learning environments. We've seen very low to little spread in our schools. And so it's really a question of that, I've been attending board meetings over the last 2 months with our Wilmington Learning Collaborative, and there are more people there to talk about mask requirements than to talk about our Wilmington Learning Collaborative. And so some of that gets pretty heated. Just keeping people following in general what you're attempting to do is an important objective of gaining the trust in the public generally and achieving the goals that we have to keep people safe. So no, I think that's a factor. The political background, if you will, or the upset, to use your words, is part of the background in which we try to make these decisions based on science and based on public health best practices.
I wanted to ask quickly about misinformation and disinformation. I know nationally, it's been revealed that it's really a small number of very powerful sources spreading misinformation and disinformation. Has the state identified on a local level specifically the biggest sources of misinformation and disinformation, and what are they?
I'm going to turn that over to Dr. Rattay.
Yeah, so Meredith, we have not done our own research, if you will, as a state. We've really looked to these other sources that I mentioned, the Public Health Communications Collaborative and FEMA, who has really, I think, been focused on identification and raising awareness of misinformation when it is seen. But our understanding is the same, that a lot of the misinformation is being pushed out by a few sources.
Our next question is going to come from Cody Decker of WRDE.
Thank you. 2 questions, if I may. Governor, I want to start with you. Obviously, we have the Super Bowl this weekend. I wondered if you considered waiting on the mask mandate lift another week, considering we still have a decent amount of cases coming from restaurants, bars, and maybe the casino. People are going to the sports book this weekend. Did you consider waiting a week?
Yeah, we thought about that. We thought about the weekend and decided to, we had in my head, we had thought about the first of this month, as if the case backdrop and the data suggested that we were in a pretty good place. Obviously, there are considerations for all of that. We just decided at the end of the day to do it before the weekend. I like to watch the Super Bowl by myself. I really am interested in the game and as much or more this year than in many past years. We've got a Delawarean who's playing on one of the teams, and we've got a team that hasn't been there for a while. But all those factors were part of the balance we try to strike when we make a decision like that. Unfortunately, you never predict what's going to happen in the future. And hindsight is 2020. So what we do know is our past experience. We know that events like this that bring people together are events that could create mini surges. And just ask people to think about that when they make decisions about what to do, for any of those celebrations. For me, I'm going to be sitting by myself with my wife in front of the TV watching, hopefully the Bengals win, and our own Delawarean do well for the other team.
And if I can just ask quickly, on the school mandate side, what is the confidence level that more kids will be able to get vaccinated by April? And what's the strategy on the state side to especially get the younger group vaccinated?
Yeah, so we never have any kind of certainty in any of the decisions that we make. What I've asked our team to do is look at other states that have had greater success than us. One of the things I think is consistent there is the involvement of the schools. Not that the schools themselves would do the vaccinating, that they would provide venues maybe and opportunities for us to bring teams in, and we're looking at that. We did have a partnership and partnerships with pharmacies. We did have a very effective partnership in getting our teachers and school personnel vaccinated earlier on, and those kinds of things. There's no guarantee, obviously. Some parents are kind of dead set against it. Dr. Rattay tries to provide all the information necessary for folks to make those decisions, but now we know it'll be important for folks to get that shot. Dr. Rattay, any thoughts there? I know we have a team on the field working on that.
We're taking a kind of a multifaceted approach, if you will. We know that people trust their pediatric providers. Pediatricians is the most credible resource. So we really strongly encourage people to reach out to your pediatrician, talk to them about any questions that you might have, any concerns that you might have. So they're a great resource, and we're working with the Delaware Academy of Pediatrics on best ways to support them. As the governor mentioned as well, we've been doing outreach with the schools, and we've seen a lot more activity lately with vaccination events at our schools, or vaccination events being planned. So really appreciative of schools for stepping up, and also community partners have a really important role to play. And so we've seen some movement in that area, but those are the fronts in which we're, the partners in which we're really looking to work with to make sure people have the information they need and know where to access the vaccine for their children.
Our next question will come from Tim Mastro from Delaware State News.
Hi, all.
Hey,
I
Tim.
have 2 questions. Firstly, just again on schools, will DPH have anyone working with the school boards to help them make these decisions or offer guidance on the data at that point in time?
Yeah, sure, Tim. Depending on what the question is or what the support they need, we do have, as the governor mentioned, we have school liaisons to support each district in the state, but we also, have other technical experts to provide support, whether it's, connecting the schools to vaccines or kind of talking through their individual scenarios. So we're absolutely there to provide the support that the districts may need in their decision making.
All right, and then I had one more question just about the flu this year. I know we were pushing vaccinations pretty hard throughout the winter. What have you seen so far out of flu season? Have we reached the peak yet? I know it can kind of vary depending on what kind of strain is out there on each year.
Yeah, so this has been an unusual flu season again. We had a peak of influenza in December and really seen a steady decrease in influenza cases, really paralleling in many ways our COVID peak, and although not nearly as many infections, but this last week we had only 12 identified flu cases, which is quite remarkable for late January, early February. What we don't know is whether we might see influenza B coming along in the near future, or maybe this is it for influenza. So it's always unpredictable. We'd love to see that we'd love to think or believe that it's behind us, but I'll still use this opportunity to encourage people to get their flu vaccine if they have not yet.
All right, and we have two pre-submitted questions this week. The first comes from Melissa Steele of the Cape Gazette. Melissa asks, lifting the mask mandate appears to pertain to everyone, but will there eventually be an exception for those who are unvaccinated? Will unvaccinated children and adults be required to wear masks, and will this be required for people who haven't been boosted?
So for some time now, prior to the January date where we reimposed the indoor mask mandate, we have recommended that people who are not vaccinated to wear masks. We haven't had a vaccination requirement, and other than that which has come through federal agencies and people working in certain healthcare and other venues, private employers have required that. The state has a get vaccinated or get tested regime, but we will continue to recommend folks that are not vaccinated to wear masks indoors and when they're in close contact with others, as has been the recommendation for some time. Dr. Rattay, any thoughts on that one?
No, not at this point. I mean, we certainly want to continue to educate, and we think that is the best approach at this point. We think that it's the most important tool in the toolbox, and there's wide access right now to the vaccine. So we really hope that people take advantage of this safe and effective vaccine.
And the last pre-submitted question of today's briefing is from Chris Barish of WHYY. Dr. Tay, I believe this is a question for you. Chris asks, how much more protection does a booster give you?
Yeah, so great question. And I last week I did go over a lot of studies, but I will just highlight a couple right now. But there are numerous studies that have really been published in the last, I would say, 2 weeks that really make it clear that the booster makes a big difference. Certainly made a big difference during this Omicron surge that we've just seen. So one study that took a look at the booster during the beginning of the Omicron surge showed that those who were unvaccinated had a 5 times higher risk of getting infected compared to those with a booster. Now, those who were fully vaccinated but not having received a booster were also still protected. So those unvaccinated were three times more likely to get infected compared to those who had just gotten their primary series. But certainly the booster is protective against getting infection more so than even those who've gotten their primary series. Another study that was just released last week from Los Angeles had really stark results in showing that unvaccinated people were 23 times more likely to be hospitalized compared to those who had were fully up to date with their immunizations, which means that they had received a booster. That number was 5 times higher for for people who had gotten their primary series, but not a booster. So although again, you can see getting full vaccination with your primary series does help, getting the booster is extremely protective against hospitalization. And our own data, and we released this in our Friday press release, where we look at how many of our cases and hospitalizations and deaths received their full primary series and how many of those received their boosters. And for the most part, it's somewhere between like 85–90% of individuals who are either cases or hospitalized or who are deaths had not received their booster and were not up to date with their vaccines. So clearly our recent experiences demonstrate how important it is to be up to date and to have that booster.
So I think we have one more question.
Yep, Governor, we have one more question from Andrew Sharp of Delaware Independent.
Hi, yes, good afternoon. This is also about the schools. Just wondering what kind of feedback you've heard from school administration or maybe the teachers' unions about the decision?
Yeah, so our team has been working on that. I was at the Brandywine School Board meeting last night for different reason for our Wilmington Learning Collaborative. I did hear a positive feedback from some of the board members there about giving enough time to make appropriate preparations for the March 31st. I know we've talked to the superintendents about it. I think I've heard from the teachers group, they were quoted on the news this morning as being cautiously optimistic and moving to this next phase. I think everybody's interested in getting to a place where children can learn more effectively, be more effectively engaged in the classroom and safe at the same time. And so that requires us to strike a balance. So I think it's been pretty positive, a little bit mixed. As I said earlier, that half the people say that it's too soon and half the people say it's not soon enough, and maybe we've got it right on the money. We'll see. We do need additional time to prepare so that the districts and schools can prepare so that they can get information out to students and parents, so parents can arrange to have their students vaccinated. I think a little bit harder about that. We just know we got to keep kids in school, keep learning. Our numbers have been really low in terms of the spread in school. I've been in schools the last couple of weeks and been impressed with what I've seen there. We're continue to make sure that our children have the best environments in which to learn. Dr. Rattay, anything else there?
Not for me, Governor. Thank you.
And so I think that was the last question. Again, thanks for members of the media and press for joining us again today. We have some good news today in that all of our data, all of our indicators about COVID spread in Delaware across our state are positive. The number of positive cases are down significantly. The number of the percent positive is down significantly from well over 30% now to 12% or thereabouts. Hospitalizations are down from 759 to 237, considerably down there. We still have a lot of work to do. We're ending the indoor mask mandate, which was just reimposed a couple of weeks ago in response to the surge after the new year. So on February 11th, that indoor mask mandate will go away, and we'll end the mask requirement in schools at the state level on Thursday, March the 31st, and work with our school districts between now and then and readying them for that for that change, work with parents in getting their children vaccinated, and really focus on those tools that we all have now in terms of if you're feeling sick, stay home, get tested, test yourself, make sure you're not COVID positive, be conscious of your interactions with other family members and particularly elderly family members or friend. I'll pay special attention as I do to visitation with my mother and thinking about where I've been prior to that. Again, we're moving into this new phase. We need everybody to take responsibility for using the tools that we have and getting tested, staying quarantined when necessary, and most importantly, getting vaccinated and getting boosted. Again, I'd like to end where I started by thanking the Laurel Fire Department and all the companies that responded to the fire there in Laurel, to the Good Old Boys Foundation for their response, along with the Red Cross and La Esperanza, really community effort down there, to the Little Creek Fire Department and responding to the fatal fire just across from the firehouse there, and all our first responders, an opportunity to think about them and thank them for their great work. Can't say enough about our Army and Air National Guard, General Berry and his troops. They've just been outstanding. Thank you, everyone, for joining us, and we'll see you next week.